Good morning. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and President of the Saskatchewan Public Safety Agency, Marlo Pritchard. Both will have opening remarks followed by time for questions.
Well, good afternoon, everyone. Thank you for joining us here this morning. Today we are enhancing the Provincial Emergency Operations Centre as a joint command centre to lead the emergency management response to COVID-19. As we continue to deal with a fourth wave of COVID-19 in Saskatchewan, this is being done to better coordinate the pandemic response between government ministries and our healthcare delivery to Saskatchewan people. This will ensure the right resources are in the right place at the right time. This will provide administrative and organizational support so that healthcare workers can focus on their area of expertise, which is providing the best possible care to patients in Saskatchewan. The pressure on our healthcare system is being caused by the current wave of COVID-19 cases is a significant healthcare challenge. But it's also a major organizational challenge, ensuring that we have the right people, the right equipment and resources in the right place at the right time. We have a lot of people and resources available across all of government to respond to this challenge. Not necessarily in the direct provision of health services, but in providing organizational supports and filling administrative roles, for example, so that our physicians, our nurses, our other healthcare professionals can focus on caring for their patients and our residents and our family members. This is a model that has worked extremely well in other emergency situations, responding to things like forest fires, floods, severe weather events. While COVID is obviously a very different kind of emergency for all of us, this is a structure that has worked very well in other emergencies that we've experienced in Saskatchewan, and we are confident that it will work well in supporting our response to COVID-19, in particular the fourth wave of COVID-19. The command center will be led by a joint management team. One will be Marlo Pritchard, the president of the Saskatchewan Public Safety Agency, who is with us here today. Scott Livingston, a chief executive officer of the Saskatchewan Health Authority, and Max Hendricks, who is the deputy minister of the Ministry of Health. It will be responsible for the operational, planning, logistical, and administrative aspects of this emergency response. The Provincial Command Center will not only streamline operations, it will also streamline communications and make sure that the public, through the news media, is receiving accurate information and receiving that information in a very timely manner. One thing that has not changed is our commitment to try to get all Saskatchewan residents vaccinated. We know that the vast majority of new cases, our hospitalizations, and the pressure on our healthcare system are predominantly unvaccinated people. This pandemic is being prolonged by unvaccinated people, and there's no reason for it. The evidence is clear. Vaccines do work. We look at the evidence, we listen to the doctors, we listen to the experts. Stop listening to all of the nonsense that is out there on social media, is what I would ask Saskatchewan people to do. For example, this week I've read and been talked to by a number of folks that I'm being paid off by the vaccine makers. Well, nothing could be further from the truth. Latest emergency order that I signed, there's a rumor that it's a plot for myself or the Minister of Health to go out and seize people's cows. Also, not true. These are a couple of the conspiracy theories, and there's many more. They're absolutely ridiculous, and it would be funny if the consequences weren't so serious today. Believing in and spreading anti-vaccine conspiracy theories is actually contributing to people dying from COVID by keeping them from getting vaccinated. We've all heard stories of people who realized this, but only when it was too late. I can't think of anything more tragic because it's just absolutely so unnecessary. Just go out and get vaccinated. The good news is this: vaccine uptake has definitely picked up again. We've introduced the new proof of vaccination policy about 3 weeks ago today on September the 16th, and in the 3 weeks since then, about 40,000 people have received their first shot, and about 32,000 have went out and got their second shot. Over 70,000 shots in the last 3 weeks. And I've talked to people as well that feel that this is infringing on their personal rights when we have entered into this proof of vaccination policy. By not getting vaccinated, you are significantly increasing your chance of getting COVID. you are significantly increasing your chance that you may end up being hospitalized due to your COVID infection. In fact, 75 to 80% of our hospitalizations are people that are not vaccinated. It's delaying people's surgeries, and it's delaying other people's access into our healthcare system. And I would say that they also have a right as well. They have a right, and the government has had to make a choice between your right to go to a restaurant, your right to go to a hockey game, your right to go to a gym without providing your proof of vaccination or proof of negative test, or other Saskatchewan people's right to access the healthcare system, and we've chosen the latter. More than 82% of residents now have received their first shot. 73% are now fully vaccinated in Saskatchewan. That's better than we were, but there's still work to do, and that number needs to continue to climb. So if you haven't done so already, I'd ask you to go out and get vaccinated. Once again, I want to say thank you to all Saskatchewan residents who have done your part and have made the decision to go out and already get vaccinated. I want to thank all the businesses and the workplaces who have been requiring and checking for the proof of vaccination since last Friday. Thank you. And I know this has been somewhat of a change, and I'm sure there have been a few hiccups along the way, but overall, I think it's in general going quite well, and it is causing more people to get vaccinated, as I mentioned earlier. And I want to thank all of the healthcare workers in the province and across the province for your tremendous prolonged effort in caring for not only COVID patients, but caring for everyone that requires healthcare service here in Saskatchewan, wherever you are. Thank you, and now I'll turn it over to Marlo Pritchard for a few introductory comments.
Thank you, Mr. Premier. Good morning, everyone. Today, the Saskatchewan Public Safety Agency is enhancing the Provincial Emergency Operations Centre from its current role of bringing together provincial ministries, crowns, agencies, and other organizations to now being a unified command with the Ministry of Health and the Saskatchewan Health Association. This is being done to coordinate the response and resources for the benefit of our citizens. The Provincial Emergency Operations Centre uses the Incident Command System, which was established to manage critical incidents. The system has proven successful and has successfully managed critical incidents for over 30 years from all levels of government, first responders, and the private sector. It provides enhanced role clarity for responses, and as the Premier mentioned, it streamlines communication. The enhancement of the Provincial Emergency Operations Centre is not about taking over the response. It is designed to more effectively pull key individuals from the Saskatchewan Health Authority, Ministry of Health, and their organizations together to better manage the information flow. The leadership from the Saskatchewan Health Authority and the Ministry of Health are all intimately involved at all levels of the Provincial Emergency Operations Centre. At the same time, the using of the Incident Command System, the Saskatchewan Health Authority and the Ministry of Health will be better able to effectively gather, analyze, and share information on a timely manner. The Provincial Emergency Operations Structure provides oversight from the highest level of government, while at the same time utilizing a multi-agency unified command, or you can call it a joint management team if you wish, to ensure that there is one source of coordination, information, and enhanced decision-making. The Joint Management Team, or Unified Command, will consist of senior leaders from the Saskatchewan Health Authority, Ministry of Health, and the Saskatchewan Public Safety Agency. As the Premier also mentioned, this model has been used effectively in previous incidents within Saskatchewan, including responses to wildfire. The SPSA has seen a very, very busy wildfire season this year, with more than double the amounts of fire that we normally see in a season. The use of the Incident Command principles has allowed the Saskatchewan Public Safety Agency to successfully address the fires that threatened, and in all fairness, continue to threaten Saskatchewan citizens, communities, infrastructure, and other values. The system has also been used successfully during other natural disasters, such as floods, both here and abroad. This is exactly why I am very confident that the Provincial Emergency Operations Centre and the ICS system, or Incident Command System, will be successful in achieving the goal of providing the right resources at the right time so that our healthcare workers are better positioned to serve the needs of their patients. Thank you.
Thank you, Premier Moe and Mr. Pritchard. We'll take questions and we'll start in the room. Arthur?
Thank you. This is for the Premier, I believe. I'm curious, it seems that you're trying to improve and streamline the kind of governance and control structure of the response, but what we've been hearing is that what's really needed is frontline health staff within ICUs in particular. And I know that you brought this up with the Prime Minister about a week ago. So I'm wondering, what does this announcement today mean for that cooperation with the federal government and with other provinces in terms of things like patient transfers? And why has it taken so long to formally submit a request to get the staff that our hospitals desperately need?
Well, yeah, I think you're correct. Today, what we're doing here today is, bringing together this joint command center to really support and augment the efforts of not only the SHA but the whole of government response to what we're facing in this province with the fourth wave of COVID-19. You've identified one of the major challenges that we have is frontline staff, and where can we access some of that frontline staff? And one of those areas where we may be able to access some supports there is external and through the federal government, whether that would be folks that would come in through the Red Cross or what that may be. We need to be realistic about what is attainable through the federal government. I believe Alberta now has federal frontline staff, critical care staff on the ground. Has totaled about the equivalent of adding about 8 ICU beds in Alberta. If you take that on a per capita in Saskatchewan, that would be 2. The addition of 2 ICU beds into about 130 that were expanded to here today. And so that most certainly is an option in the days ahead, and I would leave that to the discussions of the Joint Command Center and through Scott Livingston, Marlo Pritchard, and Max Hendricks. There is another area, and this is an area where rightfully we should be looking for every opportunity and every resource that we have before we go make an external request, and that is, is there an opportunity for us to even look deeper within our province as to are there, ways to support our frontline staff, in particular those that are working in our ICU departments. And I would go back about 3 weeks when we had slowed down a number of services, I believe about 175 services across the healthcare system, signed the emergency order, which it reenacted the letter of understanding, which is the only reason the emergency order is in place, I might add, so that we could direct healthcare employees to where they're needed within the healthcare system. Those 2 changes allowed us to go up about 50 beds in our ICU departments, up to about 130 from about 76 or 79 is where our base was, to go up to 130 beds, of which we're approaching here today. The second slowdown that we had brought in, which slowed down an additional 100 services, bringing in us up to about 275 services being reduced or slowed across the healthcare system, was actually to attempt to bring that ICU capacity from 130 up to actually above that, maybe even up into the area of 175. That second expansion is proving to be very challenging across the healthcare system, and that is one of the first things that I think the provincial command is going to have a look at is there any ability internally to reorganize to increase our ICU capacity beyond the current 130 where we are. Is there a need, and there quite likely may be, to make the request of the federal government and what that request would look like, and that work continues and is ongoing on a daily basis. But we're also realistic with respect to what the federal government can actually provide. And we're also, I want to be very realistic as to, what we can actually source internally here in the province. And so this is some of the work that the Joint Command Center has been happening in the SHA, but will continue at the Joint Command Center level now.
Follow-up, Arthur?
Yes, one follow-up, sort of in a different matter. One other thing that you brought up with the PM, I know that you talked about, was the need for rapid tests. Mm-hmm. And we've been hearing from school divisions that in the past week, they've only gotten enough for about 15% of the student population. Businesses are also waiting weeks to get these tests in some cases. So I'm wondering what have been the challenges in getting enough tests for the demand that we're seeing, and what are the bottlenecks in terms of distribution and getting them where they're needed?
Yeah, so we've received about 1 million tests. I believe we had another 500,000 that showed up here recently, and another 500,000 maybe coming in the near future from the federal government, if memory serves me correctly. What I had urged the Prime Minister on our call to do is to look into approving any and all rapid test sources that we have. So the more the merrier, if you will, and then to look at procuring additional additional tests for the provinces as well as we move forward. I believe our standing request of the federal government is for 1 million rapid tests each and every month, and then to distribute those out to schools, out to businesses, and make them available to the broader public as well. Some of the challenges with those 1 million tests is just how they are distributed in groups of 5 or 25, where you don't just get one test when you go in, you get 5 or 25 tests. I met with a school division here in my constituency over the course of the past week and a half, and they were quite thankful and felt that the rapid tests that they did have, they were part of the original pilot, were highly effective and appreciated, and they do want to have access to more. And so we have a standing request with the federal government for 1 million a month of the rapid tests to be made available, as well as some of the newer types of rapid tests that are being approved by Health Canada to make some of those available as well. And we may look, and this would be something that the Joint Command Centre will be looking at in very short order, is should the province go outside the federal government and look at procuring additional rapid tests, because I agree, the more that we have available and the sooner that we have them available to Saskatchewan people, they are a first line of defense and offense really in our battle in this fourth wave of COVID-19. And so those are that summarizes, I think, a little in a little more detail the conversation that I had with the PM, the request that the province has of the federal government as to 1 million rapid tests coming monthly, and the potential for us to look outside of the federal government at procuring, additional rapid tests to make them available to Saskatchewan people, and we'll do so if we feel it's necessary.
We'll take another question in the room. Murray?
We're on the verge of another long weekend. Since the last long weekend, we've seen 123 deaths. We've seen 221 more hospitalizations. Nothing in today's announcement is addressing restrictions that people are calling for that actually would possibly deal with those issues. Why are we seeing no social distancing? Why are we seeing no household gathering restrictions? Why are we seeing no public place gathering restrictions, given the numbers as just outlined?
Because the vast majority of Saskatchewan people are vaccinated. And we're not going to be implementing broad-based restrictions on, 80-some% of the population that has gone out and gotten their first shot, over 70% that are considered fully vaccinated. That being said, we have significant measures that are in place. We're wearing a mask, for instance, when we're not speaking in this room. The proof of vaccination policy that has just become active on October the 1st is pushing our vaccination rate up. We're probably 4 or 5, maybe 6 times the vaccination rate that we were 4 weeks ago before the announcement of this. We saw an initial surge on, I believe it was September 16th when I had made the announcement. We saw that surge go even higher on October the 1st when the policy actually did come into place.
Isn't the fact that you are actually today moving forward the Provincial Emergency Response Operations Center to take over this situation an admission that what we're doing right now isn't working, and that we do need to do further measures as suggested by doctors? And I guess I'm kind of curious why we're not seeing a state of emergency today, given the nature of this announcement. Right. On one hand, you're basically saying that what we're doing is not working. On the other hand, you're offering the same explanations you've offered before, which is most people are vaccinated.
Yeah.
It's not really working too well, is it?
Well, the Joint Command Center that we're bringing together here today, and Marlo, you might have a few comments on how the Public Safety Agency has been involved throughout the COVID-19 pandemic, but really does a few things. One is formalizes, I think, some of the work that has been ongoing, and some of the partnership work that has been ongoing between the Public Safety Agency and the Saskatchewan Health Authority. But really what today's announcement with the Joint Command Center is, it's about supporting the organizational and the administrative efforts of our response, our whole of government response to the fourth wave of COVID-19. And what the intent of today's announcement is to allow the Saskatchewan Health Authority and the over 40,000 plus employees that we have within the Saskatchewan Health Authority that have been working so very hard for over a year now to really focus on just primarily delivering that health care, as opposed to, for example, organizing large-scale vaccination clinics, pop-up clinics, organizing some of the testing efforts that are happening on the peripheral that are part of our response to the COVID-19 pandemic, and part of what the Public Safety Agency has been involved with at maybe more local and regional levels in the province since the beginning of COVID-19. But I'll let Marlo speak just a little bit to the public safety agency's involvement in the COVID-19 response and historic involvement with the Saskatchewan Health Authority, and then, how you see the Joint Command Center supporting those operations as we move forward.
Thank you, Premier. Just the first comment I'll make, it's SPSA is not taking over the response. That is not the intent here. It is around the coordination and better alignment. The Saskatchewan Public Safety Agency has been involved in the COVID-19 response right from March of 2020 in different aspects. We have had resources deployed early in the days up to La Loche to help that community set up their EOC and their self-isolation. We backstopped, and I'll use that term, the 1855 line, getting information out to the members of the public. Supported the business response team and around some of that information gathering. We have, helped the vaccine rollout. We supplied staff to the Ministry of Health and SHA, and again, trying to increase the capacity, again, maximizing our resources and our expertise around, not only logistics, but again, planning around an incident and a crisis. We've also been heavily involved with different communities and regional EOCs, setting up their local responses. We've supported communities when some communities were needing of whatever, whether it's personal protective equipment or other equipment that community needed during this event. We were there, and we responded to help where we could, or at least problem solve and find the right avenue for them. Our staff have been active in a very, very large number of communities throughout the province. And in all fairness, we've been working closely with both SHA, moving nurses and equipment and vaccines up to the north, and the Ministry of Health right from the beginning. So this is, again, I want to reiterate, this is not a takeover. This is just a changing of a structure going into a unified command. Instead of us being a kind of a support role, we're now going to be a unified role. And I think, again, using the absolutely fantastic skills that my staff have, we will be able to see benefits very quickly, and hopefully those will be around those resourcing and clearing up some of those administrative duties that in all fairness, we can take on. So I'll stop there, Mr. Premier.
We'll take another question in the room.
For the Premier, you said no restrictions. We have the highest case rate, highest death rate in the country right now, and there's no signs of it slowing down. So what is on the table in your mind if this situation doesn't improve? Because it's been 3 weeks since we put in our last set of measures, so we can't ask Dr. Shahab for his recommendations. He's not here today. What is on the table in your mind going forward that people could be prepared for if we don't see an improvement in the cases and deaths?
Yeah, we announced a number of measures 3 weeks ago. The proof of vaccination measure has come into effect about a week ago. The mask, we had additional measures that came in previous to that. As we go forward, there's an ongoing conversation that will happen between our Chief Medical Health Officer and not only the Minister of Health, but also with the Joint Command Center, as Dr. Shahab will be intricately involved in providing advice to the Joint Command Center, and with respect to public health orders, they potentially do go out under Dr. Shahab's signature as well. Listen, as we move forward through the next number of weeks, our goal and our effort is to identify and make available as much resource as we possibly can to support the healthcare needs of not only those that have COVID, but to support the healthcare needs of all of those that are requiring healthcare here in the province, and to increase our vaccination rate. Ultimately, our way through this pandemic is through a vaccination clinic. I had said that very early in this, and thankfully, we have seen that vaccination rate increase since our announcement 3 weeks ago, and then further increase on October the 1st when the policy took place. And we understand that this is inconvenient, and we understand that is making life more uncomfortable, in particular for the unvaccinated. And I'd indicated that was going to be the case a number of weeks ago. We understand that there are some that mostly unvaccinated folks that don't like the policy that we have put in place and feel that it is infringing on their rights. And I would say that with with 80% of our COVID hospitalizations being people that are unvaccinated, that by the choice of not being vaccinated is infringing on people's rights to access health care in this province. We have always said since the beginning that is going to determine the decisions that we ultimately make, and that's determining the decision that we're making around proof of vaccination. We're going to preserve people's right to access health care in this province. That's why we have moved forward with the proof of vaccination, proof of negative test policy. And I would say it's being largely effective in the province. I see, a note here this morning where I believe the Federal Public Service is putting in place a vaccination policy. I think there's about 300,000 federal employees. It looks like there's going to be about 200,000 that are exempt from that policy, which is troubling. That really, makes it seem like somewhat of a hollow policy, and I think the federal government should relook at, ensuring that when you do put in place a vaccination policy for your public service, that it actually extends to as much of the public service as possible.
Follow up, Adam?
I guess you didn't answer my question though. Like what is on the table if we don't see case numbers go down and hospitals continue to be overwhelmed? Are gathering restrictions off the table completely? Should people just get used to an average of 7 to 10 deaths a day going forward in the next couple of months, because the trajectory we're on isn't changing, and vaccinations, as you know, take time to take effect. So for the doctors, the Saskatoon City Council, who have asked you to do more, are you saying that's not an option right now?
I would say that nothing is ever off the table as we find our way through what is now the fourth wave of COVID-19. No one, including the government of Saskatchewan or the people of Saskatchewan, have been through a challenge like this. Most certainly, nothing of this scope in recent history. And so, there's no decisions that would ever be not on the table, so to speak. As we move forward, we're very cognitive, or very aware of the fact that the vast majority of Saskatchewan people have done the right thing, and we're very resistant to the fact of imposing broad-based restrictions across society, understanding that the majority of Saskatchewan people have done the right thing. What we continue to do is ask and make life increasingly uncomfortable for those that have not yet been vaccinated, as they ultimately are the people that are predominantly ending up in our hospitals. 80%, 75 to 80% of our hospitalizations are people that are unvaccinated, and quite frankly, they're tying up healthcare services that other folks may need for other reasons.
We'll take our next question from Lisa.
Why is Dr. Shahab not here right now, and he's not part of the leadership for this provincial command? I mean, he is the top doctor in the province.
He's a public health officer. He's a chief medical health officer, and he'll be out again publicly, as I assume. I don't know when. Him and I at various times to answer questions to the media. But what we are here announcing today is that we're moving forward with this joint command center to really support not the operations only of the SHA, but yes, to support them, but to support the whole of government response to the fourth wave of COVID-19 in Saskatchewan.
Marlo, did you want to comment on that?
Yes, thank you. Dr. Shahab will play a key role in this. He is the advisor to the joint management team, the executive team. So again, he is part of this structure. This announcement of the Provincial Emergency Operations Center is what this purpose of this today is. But Dr. Shahab is and will continue to be a key player as we move forward in dealing with COVID, the fourth wave of COVID.
Follow up, Lisa.
How much are you following the Chief Medical Health Officer's recommendations at this point? Do you have confidence in his recommendations? We know that he said publicly about 3 weeks before you actually put it in place that he recommended a mask and a vaccine mandate. So again, how much are you following his recommendations? Do you not have confidence in them anymore?
No, absolutely. Dr. Shahab has, in many ways led us through from a public health perspective. The last 20 months led this province and the people through this challenge that we have. If you think back to the early days where, our only tool really was public health measures that we implemented in a significant way here in Saskatchewan, likely more significant than ever seen in the province's history, dating back even to, 100 years to pandemics like the Spanish flu. As we found our way through month by month through the pandemic, we had additional tools that became available. Largely and most effectively was the access to vaccines. 4 different vaccines have been made available here in Saskatchewan that largely address this pandemic that we're facing. And if we continue to increase our vaccination rate, I think we ultimately will see at least our hospitalization rate starting to reduce. Back to my conversation with the Prime Minister last week, there's increasingly Public Health Canada is approving other early intervention treatments that may be available and may be effective also in pushing that hospitalization rate down into the future. And we'd asked the Prime Minister and the federal government to make those available to provinces as quickly as possible. And it sounds like ultimately they will be. So no, most certainly Dr. Shahab has worked alongside the Minister of Health, the Saskatchewan Health Authority, throughout this pandemic, and is now, as Marlo has just said, will be a critical part of the Joint Command Center as we move forward in ensuring that providing them advice, but also providing the Minister of Health advice with respect to any of the changes that we may need to look at. To Adam's question earlier, any of the changes that we may need to look at potentially as we find our way through this 4th wave.
We'll take our next question from Connor.
I guess a few weeks ago, you had some projections come out in terms of how many people you expected to end up in ICU and, to justify those slowdowns. So are those still the same? It looks like we're getting pretty close to some of those numbers in terms of how many people are in ICU and hospitalized with COVID now. Do you have, I guess, some new projections in terms of how many people you think are going to end up in hospital before this 4th wave is over, and I guess what might further slowdowns look like in order to, to accommodate that demand?
Yeah, the projections, I would have to ask, I don't know if it'd be the health authority or Dr. Shahab himself to interpret what they see as some of the projections. If I recall right off of my memory, the projections that we had, we didn't achieve them in the time frame that had been put forward, which is a positive. However, we're starting to achieve them in the weeks after, so it's taken longer to achieve some of the numbers that I think were in the projections with respect to ICU and hospitalizations across the province. And that is why we had seen the Saskatchewan Health Authority, planning to expand their ICU capacity, total ICU capacity to 130. I believe 50 were for non-COVID patients, 80 would be available for COVID patients, and then have the further expansion plans to go to 125 COVID patients, 50 non-COVID, a total of 175 ICU beds, and not the only, but that would be one of the reasons that we bring together the Joint Command Center here is there some operational, some coordination opportunities that we might have here that would further avail resources to go beyond that 130 ICU capacity here in the province, so that people can receive health care if they have COVID and need that health care in an ICU capacity, or if they don't have COVID, it's something else, a car accident, heart attack, surgery, any of those other needs that we have that are ongoing to provide health care here in the province. And so what today's announcement isn't about further public health measures or what what may be needed in the way of further public health measures. That's still a conversation that Dr. Shahab ultimately would lead. But today's announcement is about aligning our all of government response to address the 4th wave of COVID that we're facing here in the province. And is there a way for that all of government response to be better coordinated to support ultimately our healthcare employees across the province, so that they can really focus in on delivering the healthcare that they have so adequately and adeptly done for so long now.
Follow-up, Connor?
Yeah, I guess at what point do you request that federal aid if the ICU numbers keep going up and you can't find additional capacity within the province? Is there a number of ICU patients where you say, hey?
Yeah, no, that's a good question, and I think that's a daily conversation has been occurring. Is what can the federal government provide, and at what point do we want those provisions, and we may in the next number of days make that formal request. But as I said earlier, we're also realistic about what the federal government can actually provide, and Marlo's, I think in fairness, already been part of those discussions. In Alberta, the provisions that they provide, the human resources that they provided to Alberta, made a total difference of about 8 ICU beds. On a per capita basis, that would be about 2 ICU beds in Saskatchewan. We currently have 130 that are available, or roughly about 130 beds that are available. So does it make a difference? Yes. But we're realistic about the scope of what that difference is, and what we're facing here, and what we do require in the way of very specialized human resources in our ICU departments.
We'll take our next question from Mickey.
Yeah, what are the support and resources that we've been asking from other provinces, and who's willing to help us?
Have you been part of those conversations as of yet, Marlo? Because you've been involved now for a few days.
I've been involved in some of those conversations. Again, it's around the federal provincial tables, looking for what those specific needs are. Again, I haven't been into that technical aspect of it, but again, as the Premier said, it's being realistic of what the help can be. And identifying where we can get those skills, if we can get them. We're not the only province that is facing some of these significant resourcing issues, but we will be continuing to have this conversation over the coming days between SHA and the Ministry of Health and ourselves, and again, making an assessment on where we can best help. So we'll continue to work with that.
And so the conversations that I've had at a very high level with my colleagues in other provinces, and I won't name which provinces, but have been around, do they have an availability of beds if we should so need it for 4 or 5 or 6 or 10 ICU beds? Would they have some of that capacity? There are some that would have had that capacity in the weeks gone by. Then the second conversation that I've had is obviously, which has been discussed here with respect to human resources from the federal government. And then last but not least, and I think it's incumbent on us before we make any official requests outside of the province, and we may or may not to in the days ahead, but before we make any official request outside of the province of Saskatchewan, that we've made every effort to ensure that we are fully coordinated with our cross-government response, fully organized with all of the human resources that we have across government, not just in the SHA, and utilizing all of the human resources that we have within the province before we start requesting assistance from outside.
Follow up, Mickey?
Yeah, human resources is such like a broad term. What type of jobs will be deployed to help, and will this result in a reduction of services in our other institutions or sectors?
I maybe start with that, Marlo, and then you could speak to the specifics. But the reduction of services has already occurred. As I said, we had reduced about 175 roughly services across the Saskatchewan Health Authority when we did our first expansion up to 130 ICU beds. Yeah. And then the second reduction was initially going to bring us up to 175, and we're going to see, is there an opportunity for us to go beyond that 130, maybe not up to 175, but somewhere in that neighborhood. The Public Service Agency, Safety Agency, does have a number of people that are highly trained with respect to some of the organization and some of the coordination of events just like this, and has been involved in healthcare coordination. I think back to the bus crash we had with our Humboldt Broncos. The Public Safety Agency was quite involved and coordinated in that very emergent event as well. But Marlo, maybe to some of the specifics as to what the Public Safety Agency can bring and how it will, where the people will come from.
Thank you, Mr. Premier. Again, the analysis, I guess, is what's coming on is what the need is ongoing. But again, this Public Safety Agency will be bringing some very highly trained individuals in regards to incident management and planning and coordinating of information. So again, through that process, we're anticipating that we will be able to take off some of that strain, that administrative strain, that decision-making strain from both Ministry of Health and SHA, so that they can redeploy if they're suited. But again, it's about that coordinated decision-making and being more timely. So again, we have a lot of resources that are trained around that administrative. We are not health professionals, but we've been supportive of health from the beginning, and we will continue to be. But ask me in a couple weeks, and I might be able to better tell you how those resources have actually aligned.
We'll take our next question on the phone line. Operator?
We have Allison Bamford with CTV.
Hi. I'm just wondering, with this new joint management team, Premier, what will yours and Minister Merriman's roles be? How will you be involved in the province's COVID-19 response moving forward?
We'll continue to be involved in very much the same way that we have been involved, thus far. There will still be conversations that happen between our Chief Medical Health Officer, for example, and the Minister of Health. But the Chief Medical Health Officer will also be providing that advice and his conversations to the Joint Command Center as well. What this is really about is less about the elected side response to government, but about coordinating and really aligning the reporting structure and the response on a whole of government, from the whole of government perspective, including the Saskatchewan Health Authority on the public service side of government. This is something that the Public Safety Agency has a lot of experience with, not just in Saskatchewan, but has also participated in incident command controls in other areas of the world. I think Marlo was mentioned earlier that the Public Safety Agency has been involved in some of the command centers in some of the Australian wildfires, for example. And so there is some global expertise that is coming to the public service side of our whole of government response with the changes that we're making today to really coordinate and align the whole of government effort and response that we have to the fourth wave of COVID-19.
Follow-up, Allison?
So last week, Minister Merriman said our healthcare system was managing in our hospitals, and now today's changes seem to say that healthcare workers and administration are strained. So I'm wondering what changed in a week that this shift in response was necessary?
I don't think it's changed in a week. We've seen increasing strain on our healthcare system for quite some time now, arguably right back to last fall, when we really started to see some significant waves of COVID-19 in Saskatchewan and some significant hospitalizations, and that has continued with ebbs and flows throughout up to and including the last number of weeks, where we've seen it increase to the point of, as I said earlier, where we've made significant decisions around signing an emergency order so that we're able to direct staff throughout the health to where they're needed to provide services, slowed down literally hundreds of services across our Saskatchewan Health Authority, so that we can support the expansion in ICU capacity that we need, largely due to COVID-19, largely due to unvaccinated people that are requiring hospitalization due to COVID-19.
We'll take another question on the line. Operator?
We have Phil Tank with the Star Phoenix.
Yes, I'd like to ask the Premier, thanks for taking my question. Do you feel you mentioned conspiracy theories affecting, our vaccination rates and where we are? Obviously, we're the lowest in Canada. Do you feel you've done enough to denounce conspiracy theories and to call them out earlier in the pandemic?
Well, we've all of our MLAs when asked, various, about various theories that are out on the internet and whatnot, have been, talking with constituents on a one-off basis. I'm doing that myself as an MLA as well in my area. I think there's, a number of conspiracy theories that, yes, elected people can address. For example, the emergency order is not in place so that the Minister of Health or myself can gather up anyone's cows. That's not why it's in place, nor is it actually capable of doing that, in particular in the current form that it's been passed. The emergency order is exclusively and only in place so that we are able to direct our healthcare employees to where they're needed within the health system. And when you read the entire emergency order, you actually see that ultimately to be the case. That is an example of a conspiracy theory that I think is fair for elected people to address. Where it gets challenging, and there's a number of them out there, but if people want to use a horse dewormer, for example, or a cow dewormer to treat COVID-19, I'm not sure about the science behind that. And a few weeks ago, I'd asked, there is an opportunity for our medical community to actually step in and explain what a horse dewormer like ivermectin actually is used for, and why it might not be quite as effective when it comes to COVID-19. However, in saying that, there are some other early intervention treatments that are becoming increasingly available that other places, the U.S., have been using that we're looking at here in Saskatchewan as well. And this is where I would like Saskatchewan people to maybe step away from the conspiracy theories that are out there and actually have an adult conversation around, what is science-based, what actually can work for us as we move forward, and what the risks are of everything that we're choosing to do. We hear about risks of vaccination, risks that the vaccine may not be risk-free. Fair enough. Not having the vaccine most certainly is not risk-free. You are greatly increasing the chance that you're going to not only get COVID, but you may end up in hospital. And so, we really need to step away from the us and them conversation, the very divisive conversation that we are having from time to time in this province, and have a much more adult conversation about, what is real and what is not real as we move forward. We are one community in this province, a collection of many, many people, and we always do better when we respect one another's decision, opinion, but most certainly try to move forward with the interest of the greater good and the broader public in mind.
Follow up, Phil?
Yeah, we have the lowest vaccination rate. We have the highest death rate and the highest case rate in Canada. Yet we're one of only 2 provinces that heads into the Thanksgiving weekend without any gathering restrictions. I know they differ from province to province, but every province has something in place. So what is it that you think you and the people advising know that other people in the country don't know?
When you look across North America as well, I believe Saskatchewan's vaccination rate is higher in 40-some states. And so when you look across North America, Saskatchewan's vaccination rate, or look around the world, our vaccination rate is actually relatively quite high. When you look at the vaccination rates of many places around the world. That being said, it needs to be higher, and it has been increasing significantly over the course of the past 3 weeks, due, yes, to a admittedly fairly controversial policy that the Saskatchewan government had put in place with a proof of vaccination. So we need it to continue to go higher in the weeks ahead. Our challenge is not just Thanksgiving. Our challenge is the next number of weeks. We need our vaccination rate to increase and keep increasing until such time that we start to have an impact on the hospitalization levels that we have.
We'll take our final question on the line. Operator?
We have Zach Becerra with the Star Phoenix.
Thank you for taking my question. I want to ask a little bit about this new command structure. Mr. Pritchard, can you say clearly how many full-time equivalents or staff will actually be freed up by the adoption of the structure? And Premier Mo, if this kind of move is so beneficial, so good for coordinating our bureaucratic response, why is it that it's happening now and not weeks or months ago?
Okay, I'll start. Thank you for your question. First of all, I do not know how many resources it's going to clear up. Again, as I indicated earlier, ask me that in a few weeks. This is a relatively new stage. But what I can say is that the incident command system is a proven system to manage information flow, correlate information, and allow for a quicker and more concise decision-making process. It's a unified command. So again, we've been around, SPSA has been around supporting SHA and Ministry of Health in many different individual responses. Now we're going to put that under a joint command or a unified command system. So again, we'll increase the efficiency and effectiveness of the government response to the fourth wave of COVID. And, and again, around the efficiencies of resourcing, we will continue to look at that over the coming weeks.
With respect to why we are doing it now and not weeks ago, it's a fair question. Absolutely a fair question. If you look at where we are and why we're doing this now, it is to deal with what we're facing here in the province with the fourth wave of COVID-19. We had expanded our ICU department by, closing significant portions of our health authority services to expand that ICU capacity up to 130. As we start to approach that number, I think it's fair for us to look at coordinating and aligning all of the resources that we have. Should we need to go beyond that, if we are, in the days and weeks ahead, to make a request of some federal resources or other provincial resources, other provinces' resources, it's incumbent on us to ensure that we are making every effort to mobilize all of the inside the province resources and human resources that we ultimately have. And so today is about coordinating and aligning that whole of government resource response that we have. But a fair question, Zach.
Follow up, Zach?
I do have one. Premier, I want to ask you about monoclonal antibodies for COVID-19. This is something you said Saskatchewan was going to ambitiously look at. I think you referred to it earlier or alluded to it, though not by name. Several doctors I talked to, though, say that this isn't really a priority for them, that it will only help a very small subset of patients, that is labor-intensive to set up, and that there are still some unknowns about this therapy. The chief medical officer for the SHA actually told me yesterday that at best it might prevent 1 or 2 admissions, and that more than half of people who are admitted to hospital with COVID-19 in this province in September were actually diagnosed in the emergency room, which means this therapy wouldn't help them. I wonder why you were so interested in this therapy, and who has advised you that this is what Saskatchewan needs right now?
There's some opportunities, and we've been using monoclonal antibodies in hospital, one type of them I understand, for some period of time. Recently, Canada Public Health Health Agency has approved some of the more early intervention monoclonal antibodies that are available. The federal government has procured some of these treatments for the provinces to make have access to. That's what I did request of the Prime Minister, is that Saskatchewan would have access to those so that we could, ultimately utilize them. And at this point in time, whether it's potentially a request of the federal government for resources to open up a few ICU beds, or whether it's an early intervention treatment that will prevent some hospitalizations, or whether it's increasing our vaccination rate, which ultimately will prevent hospitalizations in the weeks and months ahead. All of those tools need to be utilized. These are the tools that we have available now that we did not have available in 15 months ago. And so we should be utilizing all of the tools ultimately that we have. Focusing those tools, for example, early interventions, treatments on folks that may be at higher risk of hospitalization early in the effort. These are the opportunities that we have today that we did not have 15 months ago, that may play a part, albeit small, individual. Each of them individually play a small part. Together, ultimately play a significant part in pushing our hospitalizations down in the weeks ahead. And that is the effort that we're always looking at across government, as well as internally looking at how we can provide the resources that are required to provide health care to the people that need it.
That concludes today's update. Thank you for joining us.